If you suffer from arthritis, you know how painful and frustrating it can be to deal with inflamed joints. Arthritis is a term that covers a range of joint diseases and disorders that affect the cartilage, bones, muscles, tendons, and ligaments in your body. The most common types of arthritis are osteoarthritis and rheumatoid arthritis, but there are many others. One thing that all types of arthritis have in common is inflammation. Inflammation is your body's natural response to injury or infection. It causes swelling, redness, heat, and pain in the affected area. Inflammation is meant to help your body heal and fight off invaders, but sometimes it can go wrong and cause more harm than good. What you may not know here is that there are some foods that can actually make your arthritis worse. In this video, we will explore 12 inflammatory foods that you should avoid if you have arthritis and why they are bad for your health. Make sure you watch until the end, as some foods on the list will probably surprise you. Now let's get started. Number 1. Sugar. Sugar is one of the most inflammatory foods you can consume, as it triggers the release of cytokines, which are pro-inflammatory molecules that can worsen your arthritis symptoms. Sugar also increases your blood glucose levels, which can lead to insulin resistance and diabetes, both of which are risk factors for arthritis. So, avoid foods and drinks that contain added sugar, such as candy, soda, pastries, ice cream, and fruit juices. Number 2. Refined carbohydrates. Refined carbohydrates are processed foods that have been stripped of their fiber, vitamins, minerals, and antioxidants. They are easily digested and absorbed by your body, which causes a spike in your blood sugar and insulin levels. This can trigger inflammation and oxidative stress, which can damage your joints and cartilage. So try to avoid or limit foods that contain refined carbohydrates, such as white bread, white rice, pasta, crackers, and cereals. Number 3. Red meat. Red meat is a source of protein, iron, zinc, and vitamin B12, but it also contains high amounts of saturated fat and cholesterol, which can increase your inflammation and cardiovascular risk. Red meat also contains compounds called advanced glycation end products, which are formed when meat is cooked at high temperatures. These compounds can trigger inflammation and oxidative stress in your body, which can damage your joints and cartilage. So try to limit your intake of red meat to no more than 18 ounces per week. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Gluten. Gluten is a protein found in wheat, barley, rye, and oats. It gives bread its elasticity and chewiness, but it can also cause digestive problems for some people. Gluten can trigger an autoimmune reaction in people who have celiac disease, which is a condition where the immune system attacks the lining of the small intestine. This can cause inflammation, malabsorption, and nutrient deficiencies. Some people who do not have celiac disease may also have gluten sensitivity or intolerance, which can cause symptoms such as bloating, gas, diarrhea, headache, fatigue, and joint pain. If you have arthritis, you may want to avoid or limit gluten-containing foods such as bread, pasta, cereal, cake, and beer. Number 5. Nightshade vegetables. Nightshade vegetables are a family of plants that include tomatoes, potatoes, eggplants, peppers, and chili. They contain a compound called solanine, which is a natural pesticide that protects the plants from insects and fungi. Solanine can also interfere with the enzymes that break down acetylcholine, which is a neurotransmitter that regulates muscle movement and pain sensation. Some people who have arthritis may be sensitive to solanine and experience increased inflammation and joint pain after eating nightshade vegetables. If you have arthritis, you may want to avoid or limit nightshade vegetables and see if your symptoms improve. Number 6. Alcohol. Alcohol is a substance that can have both positive and negative effects on your health, depending on how much and how often you drink. Moderate alcohol consumption can lower your risk of heart disease and stroke by raising your HDL cholesterol levels and preventing blood clots. However, excessive alcohol consumption, which is more than 3 drinks per day for women and 4 drinks per day for men, can increase your inflammation and oxidative stress levels, which can damage your joints and cartilage. Alcohol can also interact with some medications that are used to treat arthritis, such as nonsteroidal anti-inflammatory drugs, corticosteroids, and methotrexate, and cause serious side effects, such as stomach bleeding, liver damage, and bone loss. If you have arthritis, you may want to avoid or limit alcohol consumption to protect your health. Number 7. Salt. Salt is a mineral that your body needs to maintain fluid balance, blood pressure, nerve function, and muscle contraction. However, too much salt can cause water retention, which can increase your blood pressure and put extra strain on your heart and kidneys. Salt can also trigger inflammation in your body, which can worsen your arthritis symptoms. The American Heart Association recommends limiting your salt intake to no more than 2,300 milligrams per day, which is about 1 teaspoon of table salt. To reduce your salt intake, avoid processed foods that are high in sodium, such as canned soups, frozen meals, deli meats, cheese, and sauces. Use herbs, spices, lemon juice, vinegar, or salt-free seasonings to flavor your food instead. Number 8. MSG. MSG stands for monosodium glutamate, which is a flavor enhancer that is added to many foods, especially Asian cuisine, fast food, soups, sauces, and snacks. MSG can enhance the taste of food by stimulating the glutamate receptors in your tongue, which are responsible for the savory or umami flavor. However, MSG can also cause adverse reactions in some people who are sensitive to it, such as headaches, nausea, flushing, sweating, chest pain, and joint pain. MSG can also trigger inflammation in your body by activating the NMDA receptors in your brain, which are involved in pain perception. If you have arthritis, you may want to avoid or limit foods that contain MSG or other sources of glutamate, such as hydrolyzed vegetable protein, autolyzed yeast extract, and soy sauce. Number 9. Saturated fats. Saturated fats are fats that are solid at room temperature, and they are mainly found in animal products, such as meat, cheese, butter, and cream. Saturated fats can increase your cholesterol levels, which can clog your arteries and increase your risk of heart disease and stroke, but they can also activate adipose tissue inflammation, which can worsen your arthritis pain and stiffness. So try to limit your intake of saturated fats to no more than 10% of your daily calories. Number 10. Omega-6 fatty acids. Omega-6 fatty acids are essential fatty acids that your body needs for various functions, such as cell growth, brain development, and skin health. However, too much omega-6 fatty acids can cause an imbalance in your omega-6 to omega-3 ratio, which can lead to inflammation and chronic diseases. Omega-6 fatty acids are found in vegetable oils, such as corn oil, soybean oil, sunflower oil, and safflower oil. They are also found in processed foods that use these oils, such as chips, crackers, cookies, and cakes. Number 11. Trans fats. Trans fats are artificial fats that are created by adding hydrogen to vegetable oils, which makes them more stable and shelf-stable. They are often used in processed foods, such as baked goods, snacks, margarine, and fast food. Trans fats can raise your bad LDL cholesterol levels and lower your good HDL cholesterol levels, which can increase your risk of heart disease and stroke. They can also trigger inflammation and oxidative stress in your body, which can harm your joints and cartilage. So, try to avoid foods that contain trans fats or partially hydrogenated oils. Number 12. Dairy products. Dairy products are a source of calcium, protein, and vitamin D, but they also contain lactose, casein, and whey, which are potential allergens or intolerances for some people. These substances can cause an immune response in your body, which can result in inflammation and joint pain. If you have arthritis, you may want to avoid or limit dairy products, such as milk, cheese, yogurt, and ice cream. So, these were the 12 inflammatory foods you should avoid if you have arthritis. Now, what do you think about these foods? Do some of them aggravate your symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.